Hi, welcome back to the channel and thank you so much for tuning in. As you can tell by the title, this video is about nursing leadership in Ghana. So I returned from Ghana yesterday, and whilst in Accra, I had the opportunity to attend the conference, which was organized by the GDNA, Ghanaian Diaspora Nursing Alliance. It was a whole day conference, but I'll be bringing you excerpts from the conference. And today's video is on a fireside chat, which was led by some of the top experts in nursing in Ghana and moderated by Dr. Matilda Decker from the GDNA. It's such an interesting and stimulating conversation, and I would really love to hear your comments. As I said, these are just excerpts from the conference, and if you'd like to view the full video, I'll put a link below so that you can go watch it. Enjoy. It's the 5th of January 2024, and a historic event is about to take place. I'm driving through the beautiful grounds of the University of Ghana, Legon, and heading towards the CD Conference Center, where the GDNA, Ghanaian Diaspora Nursing Alliance, is holding a conference with the theme Reimagining Nursing in Ghana Through Education, Research, Clinical Practice, Leadership, and Management. This video highlights excerpts from the fireside chat titled Beyond the Bedside, Enhancing Patient Care Through Leadership in Nursing and Midwifery in Ghana.
What an amazing event so far. And it's such a privilege to be sitting here in the midst of experts in leadership and my fellow colleagues. So as Foster mentioned, I am Dr. Matilda Decker, co-founder and vice president of the Ghanaian Diaspora Nursing Alliance. I am a family nurse practitioner and a faculty at the Johns Hopkins School of Nursing. And I think I will let these experts introduce themselves. I don't want to limit all the work that you do with my brief introduction. So I will start with Dr. Tego.
Thank you, Matilda. My name is Apostle Dr. Thomas Niteguti, a retired mental health nurse. In actual fact, I was once the administrator of the nursing division of the Accra Psychiatric Hospital, and I had the opportunity to also go and work with the Nursing and Midwifery Council of Ghana as the regional officer in Greater Accra. And currently I'm on retirement, but I'm engaged in various training programs across the country. And I also lead a church in Ghana. Thank you.
So I'm Nana Asante. I'm the current board chair of the Nursing and Midwifery Council. I am not just a nurse, I am a nurse, a very proud nurse. I was trained and I worked clinically in the US. Moved back to Ghana, and I'm also a nurse entrepreneur. So I have to speak on that subject because I tell people, we all know nursing is not easy no matter where you go. We have a lot of challenges in the system here, but those challenges are also opportunities for you to grab and think outside of the box so that you are not just a nurse, but you are a nurse, a proud nurse, and a nurse business owner as well. In addition to that, I'm also very proud of my breast cancer support foundation called Embrace. We have patient navigators in 20 hospitals. So if in your practice, if you have any patient who has some breast concern, who is diagnosed with breast cancer, please know that all the major hospitals that offer cancer care, Tamale, Cape Coast, Confranoche, we have navigators there who will be there to support the patients. Thank you. Hello everyone. My name is Perpetual Freyan Pofu, and I'm also a very proud nurse. I'm a nurse educator, and I double as the president of the one and only Nurse Educator Association, which is the Ghana Registered Nurses and Midwives Association. I do a couple of things. I'm a licensed pensions trustee. I also chair the West African Health Sector Unions Network, and I am part of the Public Services International Health Task Force, and I do a number of things. But I'm very passionate about social protection of workers, issues to do with migration, and adolescent health. So I'm happy to be here, and a big thank you to GDNA for this invitation. And I have a lot of DNA that makes me Ghanaian.
Thank you so much. And I think I forgot to mention, I'm also an entrepreneur. I have my own independent practice in the States, so that is what nurses can do. And we hope and pray that it's, very soon, sooner than later, we can see the same for our nurses here. So I think we can just go right into it, as we were behind on time. And, as Foster mentioned, our fireside chat, the topic is Beyond the Bedside, Enhancing Patient Care Through Leadership in Nursing and Midwifery in Ghana. So my first question, and it doesn't matter what order, is what does an effective leadership mean in the context of nursing and midwifery in Ghana?
Well, thank you. I think in the context of what we discussed this morning, looking at the transformations that is being advocated, nursing leadership must be wired towards said transformation. Hitherto, nursing leadership has not been a formalized training program. I mean, you get into nursing, you rise in rank, and by the mere fact that you become a senior nurse, you are a nursing member. And therefore, you probably attain the position of a senior nursing officer, a principal nursing officer, or whatever, and you're automatically a nursing leader. And very often, it is your discretion that is at play in your leadership role. But I believe going forward, looking at the new structure for evidence-based care, looking at the social demographic changes, and even looking at the disease demographic changes in the health sector, we need to train a new nurse leader who will be competent to lead the team in terms of advocacy, in terms of bargaining power, and in terms of decision-making, be a participant in decision-making within and without the health sector. And therefore, I would say the new nursing leader must be a leader with the marks of an emotionally intelligent person. Unless you become emotionally intelligent as a leader, you don't qualify to be a nursing leader. Thank you.
I want to support what he just said. That leaders, I just did a leadership class. I just took a leadership class, and there was a question that was posed: are leaders born or trained? My name Echan means leader, so I've always felt it. But it's not enough to say my name is Echan and I'm born to be a leader. But if you're not trained to know what it means to be a leader, it's not just you rose through the ranks to all the different levels, and now you're a senior manager and you're director of nursing, so you're a leader. How do your people see you? Do they feel supported by you? Are you able to fight for them? Do they buy in your vision? What is your vision as a leader? If you're a nurse manager, what is your vision for that unit that you head? It's a leadership position. If you're a preceptor, you're a leader. What is your vision? How are you able to communicate that vision, to get people to share into that vision, to make it a reality? That's all part of leadership. I think that's something that we need to start talking about, developing intentionally, strategically. What kind of leaders? I think one of the things that doesn't help us is we don't know how to advocate. So how do we teach leaders to advocate and make each one, whether it's a side, other, lower, whoever, even if you use the cleaner on your unit, you're managing that unit. How do you get that cleaner to share in the vision that, no, you can't leave things on the floor, if there's a water spill, somebody can form. How do you lead? Strategically, intentionally. So I think that we need to be strategic and intentional in the kind of leaders we want. Where do we want nursing to go? And teach people to be in that same, share that vision. So when they're on their floor, when they're in the public health setting, when they're teaching, we all have one goal, and that is, as we reimagine nursing in Ghana, the one goal is to elevate the profession. So yeah, I think training the leader is extremely important.
Okay, so let me start this way. Nursing and midwifery in Ghana has gone through several phases since it started in Ghana. Effective leadership, as you asked at this time, it should be somebody who is able to influence and support. But before anybody can do that, one, you should know who you are. You should know yourself. Knowing yourself means not just your personality as to who you are, but you are first of all a nurse. And just like we heard earlier, you are not just a nurse, you are a nurse. Whether in clinical practice, in administration and management, in research, in academia, wherever you find yourself, indeed, you are a leader. Sometimes we look at leadership as if, okay, it's some people somewhere who are leaders. But you are a leader. And no matter where you find yourself, you can influence, you can support. But as I'm saying, you must know who you are and understand from that perspective to be able to support. You must have a better understanding of the organization in which you are. Most of us may find ourselves in the clinical area. So that hospital you work in, whether a public hospital or a private hospital, you must understand the institutional vision and how it translates to your own vision as a nurse and to the team you work with, so that you'll be able to influence them. And the environment should be created in such a way that it helps to influence. Many a time we get these complaints from younger nurses. Some of the older nurses are not too kind to us. They want to push us down. They don't listen to us. And all sorts of complaints. If you talk to the older ones, they will tell you, oh, the younger ones don't listen. They are in a haste to get to the top. They don't respect. And all those kind of things. But the truth of the matter is, we must find ourselves and understand where we are in terms of the level at which we are in terms of progressing in the nursing and midwifery career, such that we must allow ourselves to be mentored. We must allow ourselves to be led. And you should also lead. And I'm sure as we go further, we'll be discussing all those issues related to leadership. But first of all, effective leadership should start with you, and you must understand the vision or the context or the environment in which you are working to be able to influence and support your subordinates, support those around you. Even if you are at the same level with them, support them. support, because it's the support that will catapult all of us to the level where we want to see the profession. Support in terms of encouraging others to pursue their education. Recently, somebody met me and complained that the facility where she worked, she went for a promotion interview, and the DDNS in charge said she should not be promoted because she has just recently qualified from the university. And I'm like, what are you talking about? So you expect that young woman to wait so many years before she gets promoted. If she's attained a certain qualification that allows her to move to the next grade, what stops you from supporting that process, encouraging it, speaking for, like Madam Nana said, being an advocate for that nurse to move on?
Became a deviant and an antagonistic junior nurse because of the leadership style of my hospital. Whenever you are called to go to nurse administration, they term the place firehouse. That's the term. So every nurse who is going there, you are prepared to face fire. And it has been said among most nurse leaders, put the fear of the Lord in the junior nurse. Or let them, I think it is time we change from task-oriented leadership to more of a resource-driven leadership, what we call transformational leadership, where we focus on the results and not putting fear of the Lord in the subordinates. Because whatever we do, it will affect the subordinates. You are mentoring. Somebody mentored. It took someone to sit with me and say, hey, and I can say, if I have to mention names, Madame Alice Aloti. She one day called me and said, hey, me in Ghana, Babi, I see leadership in you, but you are antagonistic against the leadership. I'm like, yeah, you guys don't respect us. You don't show respect. You have become so personal in leadership. Until you change, I'll be who I am. So gradually she mentored me and she ensured I entered into the nurse administration as a deputy director of nursing services. But for her, I was even run out of nursing. I never felt proud calling myself a nurse at the time because I was a media person and proud to say so. Therefore, our leadership style influences those beneath us. And I am advocating that nursing leadership, right from the training days, should inculcate collaborative and transformational leadership into our nurses. I don't know whether in the nursing training institution there's a curriculum leadership training, right, with GCNM. But there should be a system that would actually bring the leadership traits of people, and not just anybody, but there are people who can be identified and trained as leaders. Thank you.
Thank you very much. I think, one of the things that resonated was that look within yourself and determine, what type of leader are you? And I think that's very important because we do all have different personalities. Some are more laid-back leaders, but you're still a leader. Some, a leader. Some are more strict, task-oriented.
You asked about challenges and opportunities. Challenges can be seen in three ways. We have the individual or the professional challenges related to the person. We have challenges related to the employing agency. We have challenges related to the work environment. So let me mention some few things related to the individuals themselves. So you are a nurse, you are a midwife. You must understand that you are a nurse and you are in a profession that requires you to grow. It indeed requires you to grow. We have some nurses who actually find themselves at the workplace and will not put in their all. If I say you're not putting in your all, you must understand the power you have as a nurse. You advocate for the patient, you are the first point of call in most facilities for anyone who is coming in there. And you must understand that you need to build your knowledge and skills every time. I meet nurses for the first time, they introduce themselves, oh, I work in this facility, and sometimes I ask them, what is the bed capacity of your hospital? And they don't know. They don't know. So, you cannot be in a hospital and don't know the fundamentals of the institution you are working in. You cannot be a nurse on a ward and you are not aware of the frequent conditions that your patients come with, or you are not abreast with the frequent medications that your patients are put on for specific conditions. You need to keep on reading. You don't only read when you are in school or when you are pursuing an academic career or qualification. You must read every day. You must read and understand the issues related to your practice. If you're in the clinical area, that is what I've said. The unit you are on, the kind of conditions, the medications, and all those things, it has to be at your fingertips. That is what makes you stand out. It makes you stand out in such, you see the nurse that she was describing, Madam Nana was describing. She stood out because she was rounded. She knew everything about what it is that she's doing. You need to be that kind of a nurse or midwife. It is not every time that you run after a doctor to ask, what do we do about this patient or what do we do about that patient? You must even go with solutions. I think you requested this, but it is not the best. I think we can go with this. And we've talked about evidence-based practice. So sometimes what you practice over time, that work serves as the evidence you need in your practice. It is not all about the research that is conducted in the field. That evidence is key. In the GRNMA, that is why we have our awards and we look at issues of innovation. And these are all signs of evidence because people have done it, it has worked, others can use same. So those are the things, but of course, when it comes to the environment in which we work, then you find CNMOs or DDNSs and other leaders in the hierarchy who are not providing the support to their subordinates. And it's a big challenge, as we have described. It doesn't give you room to grow. It doesn't give you room to innovate. It doesn't give you room to aspire to be who they are. You understand? But it's also a call on nurse managers, nurse leaders, whether it's in the hospital or wherever, for us to change our attitude, to support and encourage, lead, mentor, and let the younger ones understand that you are there to listen and to find solutions to their problems. It is not, you see, when you enter a facility that is having a good leader, you sense it, you feel it. Everybody is happy, they are not afraid, you know, they walk chest out because they know they have a solid backing. And it's just like me, as president, I walk out boldly and with confidence, and you know the reason why, because I know I have my backing. The 94,000 and over nurses and midwives, you understand, who are members of the association. So leaders must provide that kind of support that gives courage to those that are working with them. Then we have our employer challenges. That one, they are numerous. You know, some HR issues, human resource issues, but now it's getting better, especially within the Ghana Health Service. So issues to do with, you have worked in, let's say, a rural facility, and you are entitled to move or to go for study leave after 2 years, and then somebody is stopping you from actually pursuing your career. And we are in discussions with the Ghana Health Service because these are all contained in our collective agreement. That if you are in an underserved area and a privileged area, at least 2 years, you should be allowed to pursue whatever program that you want to, unlike your counterpart who may be in an urban area. Okay? And then you find employers also making it difficult for you to access even your transfer grants when you are transferred. These things may seem off in terms of the work, but it has direct impact on what you do. You do overtime or you are called in and then your allowances are not paid because somebody thinks that you don't deserve it. Or you have to go for a workshop, you have to go for a training. It costs this much, you need the employer to support. And they are telling you there are no funds. But you turn your head and a medical doctor is requesting for same, or some other professional is requesting for same, and it is granted. So those challenges make it difficult for professionals, but at the same time, there are opportunities. There are opportunities for growth. Currently, when you look at the way we are progressing with specialization or with academia, it affords you the opportunity to pursue your nursing career up to any level that you want to. The opportunities are there. Even those who do the auxiliary nursing, which we've consistently talked about, that it's about time we stop it and have the entry as degree training. Because you see, these auxiliaries are employed, they are posted, and they realize that is not the level that they aspire to be. And they end up using their time to pursue higher education. And it affects the work. So if you employ somebody within the shortest possible time, they want to go to school, or they are doing it using the evenings, or using their whatever time available to them, or running nights so that they can do day, then they should tell you that it's a program that should be stopped. It's about time. But of course, we understand the political agenda that surrounds it all. But we will continue to advocate for its stoppage. So it's essential that even as you may find yourself as whatever professional at whatever level, whether auxiliary or diploma, you also pursue higher education in order to make yourself the best in the profession, and these opportunities are there. We have the capacity as a nation. We have the population pyramid with the base as the youth. We have majority of the population as youth, and it will amaze you. Year in, year out, thousands apply to do nursing and midwifery, and they don't even get the opportunity because there's limited space. There's limited space, but we can do more in terms of improving the infrastructure, and even as some leave due to migration and the rest, we can still have a lot more who will stay and provide the health needs of the society. And let me end it here.
Thank you so much.
That's the president. Main challenges for the nursing leadership. One, either the misinterpretation or misunderstanding of the various generational cohorts. If you're a nurse leader and you don't appreciate that, probably you are in the baby boomer range, and somebody is a Gen Z or Gen X, there will always be conflict. Because each generation comes with their own communication style. They come with their own motivations and values. And therefore, as a nurse leader, how do you appreciate the different generational cohorts so as to deal with them, to bring out the best of them? It's a challenge. The second challenge is the hierarchical nature of nursing, where there's somebody at the top wearing a belt and like, I've come. And you tend to make the junior a follower. Leadership grows within an environment like a seed. Every leader, everyone is born a leader. The attributes are there. But for you to develop an attitude, somebody must help you develop an attitude. Meanwhile, the environment in the hospital, that's not allowed. The environment makes most nurses as followers. The doctor calls you, go and do this. Your boss calls you. So you are always bothered about, sometimes without any rationale. And therefore you are a follower in an environment where you're supposed to be a leader. So you grow up thinking like a follower. And you cannot be a leader whilst you are thinking like a follower. Therefore the challenge is for us to begin to inculcate in the junior nurse right from day one the thinking mindset of a leader. So that when they begin to grow, because leadership is made up of 3 issues. The attribute is 1, you are born leader. The attitude, the aptitude is 2, you can learn. But the most important element of leadership is the mindset. Leadership is all about mentality. And therefore, if I come to a workplace with the mindset of a leader, and somebody tries to suppress me and make me a follower, before you long, I spend 8 hours, large portions of my time is spent at the workplace. And I inculcate certain behaviors for my workplace. Before I know follower, I begin to think like a follower, and if I'm not careful, I let go my leadership attribute. So it's important, it's a challenge. I don't know how leaders within the hierarchy. It's good to have a hierarchy. But the hierarchy must be such that it must be a hierarchy that encourages collaboration, a hierarchy that encourages decision making, a hierarchy that watches the back of the junior staff. I think Nana said it all. You have an issue with a doctor, and your own boss will come and say, oh, when there's not here, and she will even insult you and give you in to the other people. You kind of lose your self-esteem. And I believe the next thing is, how do we manage the resilience of the nurse? Because the work of the nurse is so much stressful. And I say that nurses come to work with a lot of emotional and psychological issues we don't look at. And we think nurses are machines. They are not, they are human. Domestically, they have their own issues. And therefore, I may be a leader. But when I come with my backpack of anger, my Ghana must go of heads, my handbag of domestic issues, how do you expect me to come out as a good leader? And therefore, one challenge is, how do we manage the nurses' resilience to be able to stand tall and lead others? Thank you.
Thank you so much. Oh, that was a lot of good information. I think what I'm getting here is support. If everybody would agree with me, collaboration, right? Innovation, and then the merge right between the baby boomers and the Gen Zs, the millennials, and I think there's in communication. I think that's what I'm getting as well. Thank you so much. I think due to time, I probably only have one more question, and then allow the audience to ask whatever questions they want. But what advice would you give to aspiring leaders in nursing and midwifery in Ghana?
Advice for aspiring leaders.
Yeah.
Believe in yourself, that you can do it. You can be at the very top. But also understand that wherever you find yourself, you are a leader. You are a leader if you are with your patient. You are a leader if you're in the classroom teaching others to become nurses and midwives. You are a leader if you are sitting in an office that manages nurses and midwives. You are a leader. You are a leader if you find yourself in a team that is taking care of the patient, or that is researching on the field, or that is doing anything that is health related. You are a leader. But you need to build yourself. You need to take advantage of the opportunities that present themselves. You see, and there's a saying that sometimes you don't need to wait for the opportunities. Create the opportunities yourself. Create them yourself. So you must understand that nursing and midwifery requires you to build on your knowledge and skills. And that knowledge and skills can only be made better when you go to school and you gain more knowledge. You learn from others. You gain more experience. As I sit here, the prof has been worrying me. Prof Yvonne has also been worrying me. When are you attaining your PhD? I said, that is the only thing that is left. Give me time. When I'm less busy, I'll attain the prof. I should combine. I will try. So You need to understand and know that now the space is the limit. You can go as far as you can go. This morning I met a gentleman whom I met a couple of years back. He was talking about evidence-based practice. Yes, it's over there. Evidence-based practice, and worrying me. That was when I was campaigning to become president. And today I met him. He's telling me, I asked him, how far have you gone with the evidence-based practice? He's in Canada pursuing his PhD, right? In evidence-based practice. So you need to push and understand that once you have the dream and you understand the profession in which you are, you can move. And as much as you move, you are able to also impact others. And you are also able to support and encourage others to go along with you. But never let the negativities within the system take you back or make you lay back and sit down and say, no, I'm not even going to open my mouth to request for this or request for that. Open your mouth and talk. You see, I always say that be assertive. It's about the choice of words. You shouldn't be angry about certain things. Don't let your emotions run. But say it gently, but with the right kind of words, and you make your point. And it doesn't matter if it is the head of the facility, the medical soup, or it's whoever, it's your DDNS. Be confident to talk about things that do not work well and advocate for things that work well. But you need to build yourself to become a leader in the future. It's very, very important. Know yourself.
I think I'll just piggyback on what she said. Leaders are trained. And anybody can be a leader. My son's name is Oyikwine. He was a terror when he was coming. It was so bad. And when you go to school, the teachers always akolabani, and they said, no, onya akolabani. You know, what he's doing is wrong. His name is Oyikwine, and I named him that for a reason. I've taught him that his name means he has to be a leader. Now, it's up to you and I to choose and direct him to the right path. He can lead people to do the wrong thing.
I have 4 values which has guided my decision so far. I take responsibility, respect, integrity, and innovation. So whatever I do, these are the 4 things that inform my decisions and actions. And therefore, to see yourself as a leader, you must also have defined values. Then also focus on learning or reading more about you and about others. You see, there are personality types that will help you become a great leader. I don't want to go there now. But personality is not static. You can always learn to transform who you are to become greater and better. To discover who you are is to dig deep into your past and to dig deep into your future and tell yourself, in the future, I want to be this kind of leader. I want to be this person. Then you pursue. Trust me, as you think about it, you can become. If you think you are the best leader, gradually you become the best leader. So leadership for me is self-discovery and pursuing your life with innate values that you use to manage your life. Maybe if I should ask 2 or 3 people here, what are your values? I'm sure we would have some people run away from this auditorium. But you need to have values as a human being. What informs your decisions? Besides the values of your workplace, what informs your personal culture? Even if you have a personal culture, I don't know. Or what informs your personal constitution?
Get a different degree, you had to write an essay, right? Why are you trying to get this degree? And I always say, right, I want to do unto others what I want others to do unto me, right? So even as a nurse, practicing as a nurse, I treat my patients like the way I want to be treated.
Your value could be empathy.
Empathy, right? Integrity. I think it all falls under it. So thank you for that. I hope this has, it's just mind-provoking to everyone. And can you look in the mirror tonight and ask yourself, what are my values? And remember why you became a nurse. And because of time, unfortunately, I can't ask the audience questions, but I know this conversation will continue amongst yourselves. And this is the end of it. Thank you all.